Botox is a botulinum protein that goes into the muscles and relaxes the muscles for up to 3 to 4 months. It generally works by decreasing the signal between the nerve and the muscle that it's going to help the muscle stay in its relaxed form. Botox is actually one of the safest procedures we do here at the office. Botox has been used for more than 40 years for non-cosmetic purposes. In early history of Botox, back in the 60s and 70s, it was used for muscular disorders, cerebral palsy, muscle spasms, torticollis, and then in the early 2000s, it was started to be used for cosmetic purposes for wrinkles. So Botox has actually been around for 30 to 40 years, and it has a very strong safety record in history. There's no major difference in longevity between Botox and DYSPORT. I usually describe it as kind of like Coke and Pepsi. They're made of a very similar substance. They're preserved and processed a little differently. However, their longevity is about the same. So whether you inject Botox or DYSPORT, the longevity is still about 3 to 4 months. Botox is a botulinum protein that relaxes the muscles underneath the skin that cause the wrinkles. Other areas you can treat, along with the frown lines, forehead lines, and crow's feet, you can also treat some of the lower facial areas, which are the overactive chewing muscles, which are the masseter, for grinding of teeth or TMJ problems. You can also treat dimpling in the chin. You can also treat platysmal bands or some of the overactive neck muscles as well. Botox is the most common procedure we do here in the practice. It's about a 5 to 10 minute procedure. The average Botox treatment lasts about 3 to 4 months. Botox is one of the safest procedures we do. We've injected well over 10,000 patients, and I've been honored to be a trainer for the maker of Botox, and I've trained hundreds of physicians across the entire world. In terms of pain level, this is a very, very small needle that Botox is injected with. It's essentially painless. There's a few tiny little pinches that you'll feel in the skin, and as soon as the procedure is over, there's no pain after. The aftercare is similar to some of our injectable treatments, which is some mild bruising, some mild swelling. We do apply a soothing gel called arnica gel, but there's really minimal bruising and swelling with Botox because it's such a small needle. There are some little bumps that can show under the skin for about 20 to 30 minutes, but most people can resume going back to work within an hour. There's 3 main activities we would like patients to avoid for the first 4 hours, and that is aerobic exercise, hot showers, or laying face down or applying pressure on the area treated. These are basically to allow the Botox to settle into the correct muscles and have the proper longevity and effect. Unlike dermal filler treatments, we actually do not want patients to massage the Botox areas. We'd like the Botox to stay in the area that we inject, and massaging it could sometimes push it into the wrong muscles. So with Botox, we do not recommend massaging. In terms of resuming exercise, usually after 4 hours, patients can resume their normal exercise activities. In terms of aftercare, there's going to be a soothing arnica gel that we'll recommend that you apply. The little bumps or swelling from the injection procedure will only last about 20 to 30 minutes. Patients can ice the area if they prefer, but in general, people can resume going back to work within an hour. Botox is generally calculated by a unit method. Because it is a liquid and it's not a thick gel like a dermal filler, it's not calculated in syringes. Most of our dermal fillers come in pre-filled or sealed syringes. Botox is a titratable unit amount based on the liquid we drop. So depending on your age and the strength and also what sex you are, men generally need more units than women, and older patients generally need more units than younger patients. We will actually calculate the exact amount of units you need and basically tell you prior to the procedure the exact amount of Botox you'll need. But it's not calculated in syringes, it's calculated in units. The decision for the amount of units we use per patient is generally based on how strong the muscles are, how broad the muscles are, how tall their forehead is, how thick their muscles are, their age, and also whether they're male or female. So all of these factors go into calculating the exact amount of Botox that the patient will need. In general, Botox is priced by a unit basis, and most areas in the face generally need about 20 to 25 units.